Today we're going to look at the MAD atomizer device that we're going to be using, and I'll show you how to use it on a patient, and then we will discuss some of the guidelines. So, here we have a patient. What can I do for you, ma'am?
I have severe pain, and I can't take pills.
Okay. We'll get an
I've had this headache for a month.
We're going to get IV in you, and...
I said no needles.
Okay, so in this case we do have an option other than an IO. And that would be the MAD device. So, for the MAD device, some things to remember. Number one, you use only 1 ml per nostril and no more. And you have to put 0.1 mLs extra when you first use it, because you have to fill the dead space in the little
I'm not
cap.
dead.
We know that, ma'am. And then you will draw up the appropriate amount of medicine. In this case, since we're not using real medication, we're just using some saline. And 0.5 or half a ml is considered to be an ideal volume for the nose. Too much and you're going to have a runny nose and the medication is going to be out and it ain't going to work and the patient's going to keep on. Now, I'm going to show you what it looks like. I will show you what it looks like later. We need to take care of the patient's pain. Ma'am?
Yes.
Now,
My head hurts.
We're going to give this to you in your nose. You haven't had any nasal surgery, you haven't broke your nose.
No, maybe, but...
You haven't been like snorting cocaine and have like a septal defect or anything?
No, none of that.
And if they have a runny nose or stuffy nose, they can blow their nose. That would be ideal to do before you use this. Then laying down like that, you would take regular 3cc syringe. Now, ma'am, it's not going to hurt at all, I promise. Ish. Aim to the top of the ear, and then 1, 2, 3.
Oh, Jesus. God, right down my throat.
So then, have them lay flat for about 10 minutes.
Okay.
So it can be absorbed. So we're going to let you be, ma'am, and you'll feel right as rain in about 10 minutes or so.
Will this headache go away?
Of course it will.
Okay.
Ish, someday. Okay, just a couple more things, and that's all for this. Right here is what it looks like, the MAD device, which is mucosal atomizer device, and the packaging looks just like that. It is in the clean storage room on the rack, and its little bin is marked. You open it up, and what you get out is something that looks like that. It's got a nice little pillowy apparatus that's nice and soft and spongy. That serves to just go in the nose, allow you to get a good seal, and keep everything from running right out. And as you saw from the video, you need to work out a 1, 2, 3. They inhale, you push. You need to push fast so that it atomizes better. The atomizing device is the hard plastic piece, and you need to push briskly to make it atomize. Now, we're going to take our syringe. You're going to put this on just like you would a regular needle. There you go. Remember that first dose is 0.1 milliliter, and every other dose you don't add that. Then you get it ready to go. Tell patient, on my count, then let's see if we can get you to see it. You can hear it probably at least. And 1, 2, 3. There you go. And remember, keep them with their head reclined. You can look at the handout to see exactly how far. They don't have to lie flat, but you don't want them walking around or sitting straight. And instruct them not to blow their nose for about 30 minutes, because if they do, they're going to blow out the medication. But it generally takes effect, and they can feel relief within 10 minutes. And that is all. Thank you. Right after this, you'll be able to see a little diagram if you need a little bit more help figuring out exactly how to give the medication is for as placement in the nose. Or you can ask me. Thank you.